There are many reasons that babies cry, and close physical contact is the most frequent maternal intervention and the most effective in terminating crying. I will be discussing maternal responsiveness to crying across cultures and the effect on both the baby and its relationship to its mother. The common causes of crying can be summarized as follows. During the first 3 months, the main cause is discomfort, usually caused by hunger. Fear of a baby forming bad habits in the first 10 weeks is the reason many parents leave their baby to cry rather than give it what it wants. Speed and efficiency of the baby to obtain the milk often vary, so many babies are caused to cry from hunger because someone is so obsessed that the baby will be overfed that they are often underfed. According to a study done by Illingworth, crying even after being fed and picked up can also be attributed to something called 3-month colic, which is caused by wind in the loops of the intestine. Another reason is the desire to be held. The crying promptly stops when the baby is picked up and cuddled. Many mothers fail to realize that babies want and need cuddling and so make the mistake of thinking that all the baby's crying is due to hunger. Studies done by Sylvia M. Bell and Mary D. Salter-Ainsworth say that crying is the earliest form of proximity-promoting signal and behaviors. Maternal response to crying stops it, and consistent promptness of response decreases an infant's readiness to use crying as a signal. This is effective in 80% of the instances in which it occurs. Feeding, which usually implies physical contact as well, was almost equally effective. Crying is actually the most effective measure a baby can take to assure itself it is going to be taken care of. By crying, a baby activates its mother's behavior. Leaving a baby to cry can be harmful. One thing that could happen is that the baby could make itself sick. If left crying for more than 15 to 30 minutes, babies tend to vomit, which is most likely due to swallowing air. Also, according to Illingworth, there is evidence that it causes psychological harm, defective weight gain, poor appetite, and low-grade fever. Some people might ask, why would a mother let their baby cry? Bell and Ainsworth say that in contemporary Western society, many mothers are deliberately unresponsive, believing that if they respond to the baby's cry, it will result in them being demanding, dependent, and spoiled. Far from getting spoiled, young babies seem to cry less when they are indulged. Among societies that approach baby care with more indulgence-centered tactics, such as immediate responses to crying, very frequent nursing, lots of physical contact, and co-sleeping, babies spend less time crying than they do elsewhere. We can also view crying from an evolutionary perspective. From what is known of ground-living primates and present-day communities of hunter-gatherers, it is believed that in their original evolutionary environment, mother and baby would have been moving around a lot and always vulnerable to predatorial dangers. Under the circumstances which tell us that such predators often went after the young older the weak, it would have been a survival advantage for an infant who had somehow lost proximity to his mother to emit a vocal signal perceptible across a distance. Also, it would be advantageous for the mother to respond to the signal promptly. Since this vocalization could attract the predator, it would make sense to have this sound eliminated as soon as possible. At the same time, it seems adaptive for an infant to continue and perhaps intensify his signals should his mother not respond quickly. I will now discuss maternal responsiveness in the Aka and Ngandu peoples of Central Africa, based on a study done by Hewlett, Shannon, Leyendecker, and Schulmerich. Both cultures can be described as traditional, small-scale, pre-industrial, or non-Western, because there is no socioeconomic class structure other than gender. Parents keep their babies in close proximity, quickly respond to fusses and cries, and feed them promptly. This is due to high levels of infant mortality. In contrast, Western societies focus on cognitive skills, since infant mortality rates are lower and they live in an environment where children cost more and success is based on academic achievement. The ACA infants were more likely to sleep drowse or be held and fed in close proximity, whereas Nagando infants were more likely to be left alone to fuss, smile, cry, vocalize, and basically were more stimulated than the ACA. To conclude, we can see that a mother's response to babies crying is, in fact, beneficial in forming strong mother-baby bonds, as well as ensuring the relative well-being of the infant.